My name is Olujimi Ajijola. I'm an associate professor of medicine and integrative physiology. I also co-direct the MSTP program here at UCLA.
I am Jay Gill. I am a MD PhD student, a seventh year in the program, which means I have completed my PhD and I've returned back to the clinical curriculum before applying to residency.
Let me ask a little bit about mentorship. Maybe let's talk about how the mentorship in the MSTP program has helped you get to where you are today.
Got it. I think about this. I have been supported from day one. So, even throughout the interview trail. So I think our relationship starts before I even enrolled at UCLA. So I was interviewing or at the Accepted Students Day for another program and was really, really being sort of courted by another physician scientist who was also Black. And, I kind of gave the feeling that UCLA was high on my list. And I was going back there and he says, all right, since it looks like we can't have you, let me connect you with somebody who I know can support you there. And so I really think that speaks to how important mentorship is and how important it is to support other underrepresented minorities who are pursuing a field where they classically aren't present. And so that's where we started. And I remember meeting you on my Accepted Students Day at UCLA. And I mean, you're already a physician scientist and it was just really, really exciting. I think I met you in your lab. And so you were coming out of a clinical meeting before you took me to your lab. And so it really was thrilling to see somebody that looks like me in that position. And so that really made me excited about UCLA. And then a couple of years later, you became the MSTP director. So it was fantastic for us to have that sort of relationship that preceded that. And since you've been the MSTP director, you've written letters for me to get grants. You've put me in rooms with people that can have like a very big impact on my future. You've connected me with people in my field that have become really important mentors. It's been really great. And it's been great to have somebody that I feel like I can have a casual relationship with and not have that sort of barrier of not being able to be myself. I think it's really, really been nice. And to see or to have somebody that kind of sees you as your full self and understands who it is you want to be and can really connect with both that sort of present you and that future you and make sure you make it there. So thank you for that.
Wow, I really appreciate you saying that. Honestly, and I'll say the feeling's mutual, I think, from when I first met you and, even our mutual friend mentioning you to me, I'd always thought, wow, okay, Jay is going places. Let me just really ride his coattails and advise and help however I can. But, it was clear that you really had a great head on your shoulders and you were determined and you were going to make this happen. And I'm just super impressed by, how things have gone and how you've done. And as I mentioned, sitting at your defense and really hearing you go through what you've done and where you're looking to go is just really cool, Jay. So I'm glad we have this friendship, mentor-mentee relationship, and even a professional relationship as well. So I'm excited for your future.
Thank you. Thank you. Thank you. How do you think sort of like some of the experiences you've had or where you come from or some of your personal traits have really influenced how you practice medicine and science?
Got it. It's a good question. I'm by nature a very jovial person, very positive. By nature, I like to make friends. I make friends pretty easily. And so in a way, when I meet patients, one piece of feedback that I always get back, almost virtually all the time is that the patients felt at ease once I met them. By the time patients are seeing me, I'm an expert in sudden death and arrhythmias, things that could, cause someone to have a stroke or die suddenly. And so the ability to kind of really disarm them of that anxiety and really get to the bottom of the issue, I think is a personal, is really, I think, enhanced or underscored by my personal traits of friendliness and I think just kindness. And the same in science, as you know, in science, you need to work with a lot of people. No one does science in a silo. Those people range from folks in your lab, your mentees in your lab, but then also your collaborators and people who, you almost sometimes have to convince. Everyone's busy, so you sometimes have to almost convince some of these folks to take out of their time to work with you. And I think, again, when I meet and talk to potential collaborators, I'm just who I am. And I know I bring no pretension or anything like that. to the interaction. I think that generally speaking, has also helps people realize, oh, I'm not, some person who's going to run away with the data or do something untoward with the relationship. I value friendships. I value trust in relationships in people, and I truly believe the motto of doing unto others what you wish others to do unto you, and that really guides my day to day.
Wow, your patients are lucky to have you. I mean, I'm so grateful to have. But, if I ever need a read on my EKG, if I ever get any scary,
you know where to go.
I know where I'm sending you a text message.
Same for you. If I ever have a patient with any sort of neurosurgical issues or anything about a brain or imaging, I know who to text, and you better write back.
Oh, I got you. I promise.
All right.
So one thing I guess we didn't talk about is your path to academic medicine.
Right.
And where you come from and your journey here to who you are today.
Wow. I'll try to be succinct, but I knew I wanted to be a physician from when I was about 10 years old. I was a kid who's always getting bumped and scraped, but, I was never afraid of the doctor's office. Most kids, are afraid to go to the doctor. Me, I was excited because, I remember my childhood clinic in West Africa being, it's a small clinic. I remember my pediatrician pretty well. I can right now imagine the rooms at that clinic, even how it smelled. It was just sort of this amazing place for me. It was very clean, very sort of sterile. It had the smell, and I just was fascinated by the place. And so that got me curious about medicine. And the more I learned about biology, I just realized it was something I was naturally good at, thinking about the body and the cells, etc. And then science really came into the picture when I got to my undergraduate studies, and I knew that to go to medical school, research is a valued sort of experience. And, I haven't looked back since. Even though my first research experience wasn't the most positive, I still somewhere in my heart loved it enough that, I said, okay, maybe I'll give it another try. And then later on in medical school, I had 2 years protected in medical school to do research. And then that really is what set things up to where I am today. And I'm really grateful for the opportunity to be able to see a patient and know what's going on with them and care for them, but then also think about where the knowledge gaps are with the therapies I can offer them and what I wish I could do for them. And then coming across the street to the lab and thinking, okay, wow, that patient really influenced me. How do I, understand how to help them figure out what's going on better? And I think that interplay truly, it's very remarkable. That's really all I can say. It's a very unusual situation to be in, and I'm fortunate to have that.
No, yeah, I think that is like the drug of all MD PhDs is seeing that interplay between the clinic and the lab. It's incredible. It's amazing. Yeah. So Olu, we kind of talked about how as physician scientists, you wear a lot of hats. You're managing a lot of different things, and that, takes a lot of time. So obviously that has to be taxing and a bit stressful. So what keeps you going every day?
That's a great question, Jay. I think I'd say probably two things. One is the passion for what I do. I truly feel sort of blessed and humbled to be in this position. And I truly mean that. Who else gets to do something that they love and really enjoy as their job? I really enjoy the clinical aspect, seeing patients, doing procedures on patients, but then also the scientific aspect as well, asking questions that impact my patients, on a very, significant level. And then getting to work with students and helping them navigate the path to sort of get to where I am, if anyone feels like that's, sort of a measure of success. I just think I'm truly living my dream. And then, sort of on the more sort of broader aspect of things is that I recognize that I'm one of very few, physician scientists of color, and it's really critical that I help nurture the next generation and open doors and break down barriers that maybe, haven't been broken down before. For example, being, I think, the first Black MSTP director in the country. I think that's, something that I feel like is a big accomplishment, and it's something that I think will also help other students that are thinking about being physician scientists see that, oh, wow, yeah, this is possible. So, those two things keep me going. I appreciate that I'm a role model. So I definitely want to make sure that I, maintain, the ability to help inspire others and things like that. So that's the best answer I can give.
Hats off, hats off. That motivates me. So thank you for that. In terms of your role as a mentor, what is the thing that you want to give most to your mentees?
Right. That's also a very important question. I think it's really comfort. When you look at how long it takes to train to do what we do, it's really a long path. And it can be quite hard, even if someone's very passionate about what they want to do and what they see themselves doing. It can be very difficult to see the full path. And so the path comes with a lot of anxiety and fear and uncertainty, despite all the joys and potential for what people can accomplish. So I think at the end of the day, we select very bright students, and I think that they all will do well. It's really just about helping them navigate the day-to-day complexities of the process and their own sort of personal fears and anxieties and personal situation to get to the end goal. Our students do really terrific, as exemplified by you. So, I think that's that comfort and that reassurance that you're doing the right thing, try this versus that, and then have the student themselves really make the decision about where the career path, goes. To me, I think that's the thing I bring to mentor-mentee relationships.
Wow, that's amazing that you said that, because that's exactly what you've given me, having this relationship where you are my mentor, but I do feel very comfortable around you. And I think that's huge for underrepresented students. When you're in an environment where you don't look like everyone else,
right.
You're by nature going to be hypervigilant. You're going to be fearful, thinking about things that could potentially go wrong.
Right.
And so alleviating that anxiety allows you to focus on what you're truly here to do and what you're passionate about. And so that's one of the greatest gifts you can give to underrepresented minorities, I think. So thank you for recognizing and for actually doing that.
Thanks, Jay. I think that, it makes me again really feel good about, what I'm doing and how to help people like us and really even the broader population, I think really get to where they want to go. I have an interesting question for you.
Okay.
What was your first impression of me?
Oh my gosh. All right. My first impression, I think you were so casual and so relaxed. I was like, oh my gosh, is this what is possible? But I think coming from the East Coast, I think I was just shocked by, how academia doesn't have to be so stuffy all the time, while also being very effective and impactful. And so that took a huge weight off of my shoulders. I know I always thought I had to be a certain kind of person, and I couldn't bring my personality and who I was into the lab, into the clinic. And I really thought that didn't have any value. And in fact, it was going to be an inhibitory factor. And I think being around you, I immediately saw that was actually a huge positive, and that was really surprising to me. And I thought this is somebody that I can be around, that I can feel comfortable around. So that was my first impression.
That's interesting. That's very much my first impression as well, as I too expected someone to be was going to be very formal. And you showed up and you were, I think instantly it was like,
So I'm not like that at all.
That was a lot of fun. I think those first few visits we had, I think getting to know each other, I think, I'd agree that sort of was my first impression as well.
Exactly. I mean, this field can be challenging in so many different ways. So why put that, strain on interpersonal relationships? You can still be professional, but still recognize the humanity and the personhood of the person you're working with.
Absolutely. Well, thinking to the future, what would you say to your future self?
I think, I would say continue to prioritize your ambitions, but also prioritize your well-being, prioritize the people around you. I think that going through a very long training period has taught me that, you can't do this alone. It's near impossible. I mean, some people are built different and they can operate in a complete silo with blinders on, but I've really, really learned how important community and my support system is. And I think that, as much as people pour into you, you have to pour into people back. And so I am excited, and I am really putting it on myself to make sure that I give back and support others as much as they support me. So I would tell my future self to continue to maintain that gratitude for your support circle, while also, prioritizing what you came here to do.
There you go.
All right. So another question for you. If you could go back in time, what would you tell your younger self?
Ooh, that's a good one. What would I tell my younger self? As one would expect, you learn a lot going, through this path, and there are opportunities, there are challenges, there are things that, come up that you didn't expect. And I think what I'd tell my younger self is to, stay strong and stay on the path. There are things that have happened that I, both good and bad, things that I didn't expect that, I think made my trajectory go this way and that way and this way and that way. But, throughout that whole journey, I learned so much, and actually it made me stronger, both, mentally, physically, and academically as well. I think, all these things I learned, I feel like I've gotten smarter as I've gotten older. So, I think what I'd say to my younger self is just stay the path, and really don't let any sort of event really take you off your path. Those things are things that arm you with more strength along the path.
Great. I'm curious, on this long path you've been on longer than me, how have you nurtured the growth of Olu the scientist, Olu the physician, in addition to, sort of nurturing these other parts of you, Olu the father, Olu the person, Olu the husband? How do you do all of both those things at once?
That's a very important question. It's very much a work in progress. I wish I had an answer, and if you ever find someone who has an answer, please let me know. I think work-life balance is critical, or some people call it work-life integration. I think it's critical that you nurture all aspects of yourself. So, as a scientist, I'm always wanting to be better at my science and want my science to do better and get in better journals, etc. So I'm always looking to learn things that I could bring to my lab to really amplify the quality of our work. That's one way I nurture that. As a physician, every day that you're a physician, you learn something new, you see something new, and then that really adds to your knowledge base that you use to help patients. And so, by nurturing that requires, again, reading, learning from each experience, listening to patients, and learning from each patient, making sure that you're not just telling the patient what you know, but that you're applying what you know to what they're asking you or what their needs are. Mm-hmm. In terms of life outside of work, as you mentioned, I'm a husband, I'm a father. I think it's important to make sure that I carve out time for my family. The way I do that is that I make sure that I compartmentalize. The science is always going. I mean, the one sort of unique thing about our field is that you carry your work with you everywhere you go. You can get a scientific idea or the solution to a problem that's been bugging you for months. It could be anywhere. It could be at a kid's birthday party.
Yeah.
But it's important to really make sure that your mind doesn't stray too much, to be present and in the moment. So if something like that happens, I sort of try to put that in a retrievable space in my mind, and then come back to it later. And I think it's, fatherhood is a massive responsibility, and I take that very seriously. So I'd say that's sort of how I nurture, and I try my best to keep in touch with people and find out what's going on with others, and making sure that I'm sort of engaging my networks of people I've known over the years, friends from med school, etc. Those all keep me going. Let me turn that around and ask you, how do you do that?
Oh, man. My friends always say I never sleep because I think I'm still in this I think I can do everything phase,
right?
Which I think I'm learning quickly is not physically possible. I want to be in the lab all the time. And I also want to share, really amazing experiences with my friends as they, achieve really great things in their careers, right, and like to go overseas and have really nice dinners, but I'm a MSTP student, so I have responsibilities and limited funds.
Right.
So I'm always trying to make all of these things happen. Right. So far, it's been okay. I make sure, or I do my best to try and take time for myself during the weekends, which means I work a little harder during the week. And that works for me and has worked for me over the past 7 years. I think residency, will come with a whole other host of challenges, but I'm learning as I go how to do both and how to maximize my ability to engage in all parts that make me who I am. So far so good. And hopefully in 15 years, I'll have a more evolved answer.
No, I mean, it probably would be a very similar answer, but, as I mentioned, the skill sets that you're, developing now to be able to manage all these things is precisely what you'll need as a resident. And so if I remember correctly, neurosurgery, is that still what you're thinking?
Yeah, okay. Definitely. So kind of, as you mentioned, my PhD work was with patients that have electrodes implanted deep in the brain that allows you to record activity from really amazing centers that regulate the foundations of human behavior, like fear and decision-making and happiness. And so that opportunity is one that I don't think I can pass up on. The ability to, one, do really amazing research, but really also to touch people's lives when they're at a very critical junction in their life road, and being able to help them when they're in their scariest life moment. And I think that's really exciting. I love the sort of procedural aspect. I love the input-output nature of it. You see an immediate effect of your intervention. So you get to kind of improve and correct in real time. I think is a really amazing opportunity and something that really fits in with who I am as a person. So yeah, I'm really excited about neurosurgery. I'm super excited about my elective and my surgery rotation. I hope I'm good. I hope I, have a skill set that really is powerful and impactful for my patients. That's one of my biggest hopes, is that, I'm good at it. Not only is it something that I want to do, something that is beneficial for everyone around me and my patients. So that's the goal right now.
Yeah, I mean, I again, knowing you over these past several years, I can definitely tell you that you are up to the task. You are good, and you will, make it happen. But I think a little bit of that sort of maybe self-doubt is too strong of a word, but a little bit of that saying, I want to make sure that I am good. I think that that's really what's going to really elevate you to the next game, to the next level. I think that if someone comes in really thinking, oh, I have this is easy, I think that they're unlikely to grow as much as someone who really has a little bit of that desire to prove and drive and make things happen. So
yeah.
I'm super excited for your future, Jay. I think it's super bright. I think it's just you're gonna make us all already proud of you. You're gonna make us all even more proud of you, and I'm just really excited to see where things go for you.
Thank you so much. I'm excited too.